Hi, my name is Dr. Paul Nassif. I'm a Beverly Hills facial plastic surgeon specializing in rhinoplasty. And today I want to take the time to answer some of the YouTube questions. And we get numerous questions per week, whether it's on the blogs or websites or YouTube. And this question is from Wendy, who is a Vietnamese young lady who lives in Costa Mesa, California. She goes, Dr. Nassif, what can I do to project, make my tip stick out further, and make my tip look more defined, smaller? Also, I want to lower the nasal tip. So basically, her tip is over-rotated, pushed back, and probably wide. So, Winnie, that's a great question, and pretty much with this, it's an ethnic rhinoplasty where we have to see, first of all, what we can do with the tip cartilage. Usually in Asians or Vietnamese, the skin's very thick of the tip, and the cartilage is really not that strong, and it doesn't have a lot of projection. And even if we do cartilage work, it's not going to make it look defined. And the more cartilage you remove sometimes, the worse the nose looks because you're losing support, and the nose becomes more amorphous looking or not sharp. So we have to add cartilage to it. Sometimes what we'll do, to project the tip and lower it, to counter-rotate or lengthen the tip, we'll use something called a septal extension graft. Piece of cartilage that's added onto the existing septum to lengthen it. At the same point with that, we'll add, with that septal extension graft, we'll make it go down and stick out a little bit further and give it more projection and lengthen the nose. We'll also sometimes take the existing cartilage here and we'll make it extended, called lateral crural strut grafts, which will push the tip out further. With doing that, it gives us the opportunity to make the tip smaller. Sometimes we'll take something called a shield graft, which is a piece of cartilage on the tip, or we call a dome graft, something right on this area to sharpen up this part of the nose. So there's different types of grafting that we can do to the nose, and everyone is different. It depends on what I find during surgery. So we have a lot of things in our surgical armory, basically, to fix noses and make them sharper. Okay, but big misconception. The more cartilage you take from the nose, sometimes the worse it's going to look. So that's not the goal. Okay? Not in every case. Thank you so much, Wendy.